Hi Sharon, it's a pleasure to meet you.
Pleasure to meet you, Doctor.
Thanks for coming.
Doctor, thank you so much for inviting me over here today. What I'd like to know now is just a little bit more about you, really, and just to find out a little bit about your practice and what you do. Where are you originally from?
I'm originally from the Northeast. I was born in central Pennsylvania and grew up in southern New Jersey.
Oh.
I went to Rutgers University College of Pharmacy, so I was a pharmacist before I went to medical school.
Oh, how interesting.
As a pharmacist, I was able to work part-time and work my way through medical school, so that helped to defray some of the bills.
Ah, yeah.
Halfway through medical school, I decided to do general surgery because that was my original intent, to be a pediatric surgeon. So when I finished medical school, I went to the University of Pennsylvania to do my general surgery residency. And then during my second year of general surgery residency, I decided on plastic surgery because I got to work with some phenomenal plastic surgeons. Oh. They were great role models, and I learned quite a bit from them. So that was my goal as soon as I did my rotation in plastic surgery.
Who did you work with?
Dr. LaRosa, Dr. Whitaker, some really very famous plastic surgeons. It was a very, very good training program.
Now, how long have you been here in Florida?
After my plastic surgery training, I came down to the University of Miami to do a craniofacial fellowship with Dr. Tony Wolfe. So that's when I came down in 1994. Also, as soon as I finished my craniofacial fellowship, I did a cosmetic surgical fellowship with Doctors Baker, Gordon, and Stuzen, who were all together at the time. They're no longer in practice together. They're a very renowned plastic surgical group, and every year they have a very famous symposium. So I learned quite a bit of my aesthetic skills from Dr. Stuzen. He's just a phenomenal surgeon.
Now tell me, Doctor, is it important to be a board-certified surgeon?
It's especially crucial for patients to understand the importance of board certification. And as such, our society, the American Society of Plastic Surgeons, is leading the initiative and helping to educate patients on its importance.
So that's really important, and I didn't realize how important that is when somebody is looking for a surgeon. Really, it should be at the top of their list.
It's very important because it proves patient safety. The crux of the matter is it all boils down to patient safety. Right. And unfortunately, a lot of it plays out in the media. You can't turn on the television these days without hearing about potentially avoidable deaths and serious complications, particularly when they involve high-profile celebrities. Unfortunately, these things do occur, but by ensuring that your plastic surgeon is board certified, it takes one of those concerns out of the equation.
Now, Doctor, do you have your own operating room here?
I do. Our facility is licensed by the state, the Agency for Healthcare Administration, which licensed us as an ambulatory surgical center. We were then certified by Medicare, which allowed us not only to do our cosmetic surgical procedures here, but also all of our reconstructive procedures. And then after we were certified, we got our accreditation by a national accrediting organization. So we've gone through 3 very stringent inspections to prove that we can do everything just as safely and effectively here in our center as at an outpatient facility, including at the hospital.
Because I would think, really, everybody that's had surgery here is in good health. When you're in a hospital, you really don't know who's been on the bed before you. So I would say that that's one factor, and I would also assume that it's a little bit more private for the family.
It is. We offer a private entrance for our patients. But one of the things that we also have is anesthesiologists, and he also helps to screen the patients to make sure that they're a good candidate for their procedure as on an outpatient basis.
Do you have any before and after pictures? I could see some of your work, maybe?
I certainly do.